Hey guys, so today we're going to talk a little bit about fillers. So what are injectable fillers or dermal fillers? Well, they are a fantastic tool that's in the toolbox or armamentarium of the facial plastic surgeon. So most fillers that we use are made of HA. This is hyaluronic acid. This is a glycosaminoglycan, or a sugary protein basically that already exists in your own skin. So there are many different companies that have many different fillers. If you go to Europe or Asia, there's hundreds of fillers on the market. In the United States, there's only about a dozen. So the FDA has required these companies to go through amazing hoops to be able to pass through the clinical trials to show that these are safe therapies, and millions of people are getting them every year. So I just want to show you what the consistency of a filler is. Often these require an injection, so we use a needle, but many times we'll use what's called a blunt tip cannula. So this is not sharp on the end, and so you can see it's basically a clear gel-like substance. So I often tell patients it's kind of like a melted gummy bear, but I'll put it just a little bit on the back of my hand, and you can see it's just very smooth and silky. These are, this one's Bellatero. A couple of the other ones that we have are Restylane, Restylane Lift, Restylane Silk, Juvederm, Voluma. Certainly when you're talking about fillers, fat is a very natural filler, so you can borrow a little fat from somewhere on the body. This is more of a permanent solution, and it's often something we'll do in the operating room in conjunction with another operation. But the beauty about fillers is that they're non-surgical. So patient comes in maybe on their lunch break, takes 45 minutes to an hour, and you can fill in tiny wrinkles and creases, or you can use it to change the shape on the face. So often people will want cheek enhancement or lip enhancement, whereas 10, 20 years ago you had to use an implant. Now you can use the sugary protein that you already have in your skin to highlight the contours and make it more attractive on the face. I've done lots of studies on aging, and as we age we tend to see drooping, but really this is from a lack of volume in the mid-face. And so I think that facial fillers have really basically revolutionized our treatment of aging in the face. So if you have any questions about facial fillers, please let us know. I really recommend that you go to a very skilled injector. These are very safe in the hands of the right injectors, but certainly, any treatment that you have has potential downsides. I would say probably one of the best things about the HA fillers is that they're actually reversible. So if you go to somebody that wasn't so good, often we'll have patients come in, and the first thing we'll do is just reverse what they've had and kind of start from scratch. This requires another medication called hyaluronidase. It's another injectable medication, but it really can reverse these fillers completely in about 48 hours. So it's a good tool that if you're using facial fillers, you need to have the antidote, so to speak, in your back pocket just in case. So if you have any questions about fillers, please let us know. Otherwise, we'll see you in consultation. Thanks.